Excellent. Dave, thank you very much. Can everybody hear me all right? Is there any feedback on the microphone or any sound quality issues?
Sound good.
Excellent. Okay. I'll go ahead and start my comments. Good morning, everybody. So first thing I'd like to do is challenge the people of Humboldt County to do something that I think is truly grand. And that is if every single person in our community does the right things, we could experience the very last case of new case of COVID-19 in our community within about 2 weeks or less. This is technically a very easy thing to do, but it just requires a number of things that people don't tend to do, and it requires a number of philosophical changes. And my plan really outlines ways that we can go about doing things like that. So the first thing I want to be able to say is, let's just start with the basic stuff. Social distancing is extraordinarily effective in ending this virus, period. It is the single most important thing any of us can do. And 6 feet is a guideline. I personally like a little bit more, but I think it's very critical to stay away from all other people at this time. The second is that if the viral particles themselves are never introduced into somebody's eyes, nose, or mouth, then it is not possible to get this virus, period. And we need to concentrate on that. I'd like to also say that the virus is not the threat. The threat is what we're doing. And I'd like to emphasize, in fact, the entire program really that I've come up with and that our team has come up with emphasizes what people can do and de-emphasizes this virus. The virus is not the critical issue. Our behaviors are the critical issue. And this entire plan aims to change people's behaviors. That's basically the nuts and bolts of the program. So most programs like this are really about public education. And I would like the board really to take the approach of public motivation, because I think that's really what we need to be doing in this case. It's a matter of motivating the public to do the things that we're going to talk about, the things that are important. So our biggest single threat is our approach to this problem. And it's my belief that the approach that many in our community are taking now is not the right approach. We need to change that approach to an approach that is more like the one that I'll outline here. So in terms of the early stages of the fight, we're really trying to combat preconceived notions, because a lot of community members are fighting this virus based on what you would think to make sense with this virus. And in the end, they're not really very helpful solutions. So we need to change to more helpful solutions, which we'll be talking about in a little while. So in terms of a police officer who learns to deal with an active shooter situation, it's not just a matter of doing the right things. It's a matter of stopping the things that you would have done before that training. It's very important to change the way that you approach the situation. Dangerous things don't necessarily look dangerous, and in a lot of cases, we're not responding to the right things. So I want to talk briefly about what it is that's dangerous versus what just seems to be dangerous. So the first is that most of us are out there scanning for people who are coughing, who have fevers. We're trying to stay away from specific people, and that is just not an effective strategy. The problem is that many of the people who will infect others don't have symptoms themselves. So if we're out there looking for people who have fevers and other overt symptoms, then it's very likely we're missing people who will actually infect us. This is a classic case, not being afraid of the right things. Several mornings ago, I was driving to my office. There were 3 people on a bench seat in a pickup truck riding together. It was a work truck. And I thought to myself, why are they not afraid of this? That scares me. A person standing 8 or 10 feet away from me doesn't scare me if they're coughing. That's not a true threat. So we need to focus on what threats are and defocus on things that threats are not. I personally think that Humboldt County is in a very unique position, and I'm going to talk about that later. We're relatively remote. We have a relatively small number of people per square mile, and we're relatively isolated. We also have very well delineated borders, as opposed to New York City, which is close to various other metropolises, and it just blends into one. Many different governments, many different officiating agencies, very difficult logistically to to treat this problem. Our community, on the other hand, has a golden opportunity because of where we are, who we are, and who our people are to eradicate this problem in our community. And that's really what my invitation is. I'm going to talk about exactly how to do that. What if we don't? Well, extracting some data that we have from having approximately 1% of the people who suffer from this illness pass away. And if we extrapolate forward, if we let this virus go in our community and it went to completion, we could expect to lose almost 200 people in our county. The bottom line is we're not going to let that happen. I want to tell you a story because I think it illustrates what we need to do here. And that is when I was a little boy, my dad and I were driving on a winding mountain road, and the cliffs were really intimidating to me. I was about 7. There were no guardrails. And it suddenly occurred to me that my dad might be the only reason that we weren't going to die that day. And I asked him about that, if it was theoretically possible for the car to go over the cliff. And he said, yeah, it was. And I could be seen, I guess I was very uncomfortable. And my dad said something very simple but profound and very applicable in this situation. What he said was, we're not going to let that happen. We're going to do the right things. And that's what I tell the citizens of Humboldt County, I tell this board, that that's exactly what our approach is going to be. As long as every single person in our community does the right things, that's not going to happen. We're not going to let it. Next, I want to dispel a couple of misconceptions because they're going around the community and they're dangerous. They're not very helpful. So the first is that this is a lot like influenza, the flu. And what I can tell you is it's nothing like influenza. This virus has a lethality, a probability of killing its host of about 1%. That's 10 times higher than the flu. This is not like the flu. It's also about twice as infectious, meaning that about half of the viral particles are required to infect a person. It's very dangerous. This is nothing like the flu. Second misconception is that it's really only dangerous for elderly people. And I'd like to explain that that's not the case at all. Plenty of physicians, young physicians, have died in Italy, and plenty will likely die in the United States. And many other people, nursing staff, and young, healthy people are dying of this illness. So we need to rid ourselves of the fact that this is only dangerous for older people and people who have underlying conditions. It's dangerous for all of us. I'd also like to discuss a statistic that I think is particularly dangerous, and that is that based on the misconception that everyone will eventually get this virus, and that's not true. If everybody in the United States got this virus, according to that theory, we could expect to lose between 3 and 4 million people across this country. So the misconception that this is ubiquitous and that it'll eventually happen to everybody is highly inaccurate, and it misses the point of what we need to do. So what exactly do we need to do? Next, I'd like to roll out the plan that we've come up with. A number of us have worked on this very diligently. The plan takes into consideration a lot of different things. But first, I want to talk a little bit about the basics of the plan. This is not necessarily only a plan that tells people what to do. This is a plan that teaches people how to think and what to see, what to notice, what issues are dangerous and what issues are not. It relies primarily on self-reliance, because I think it's important that our community focuses on what every single one of us can do to stop this virus. Self-reliance. Every one of us takes power for ourselves, and if everybody does that, then collectively the community will come through this unscathed. My feeling is that in the end, we can only control ourselves. And if every single person in our community always, under all circumstances, respects social distances of 6 feet at least, and my preference is 8 to 10 when possible, and we certainly have the real estate here in Winnemucca in Humboldt County to do that. There aren't that many people in our county, and we can do this. This is very important that we do. The next thing is that we're not relying on other people to do what's right. Because if every single one of us does what's right as individuals, then collectively all the right things happen. It's very important that we do that. I'd like to draw your attention to a car accident, and that is that none of us have as our primary safety strategy while driving that we hope that other people will do the right things. We hope that our legislators will pass safer laws. We hope that the manufacturers will make better and safer cars. Most of us have as our primary strategy that we're going to do a good job driving. The fact that we're wearing a seatbelt adds safety, but it's not our primary safety strategy. I'd also like to point out that the fact that most of us will never know the driving records of the people operating vehicles next to us, we'll never know what that information is. But we can still make safe plans by doing the right things ourselves. We're running into a lot of trouble with HIPAA laws and various other guidelines. And it's very difficult for people in the public to be able to get information about other people. People are wandering around wondering who might have this virus, but it's not an effective strategy. The effective strategy is to concentrate on what you are doing. If every single person in your environment has COVID-19, but you do the right things, you will not get this virus. It's no different from driving a car. We drive defensively enough that dangerous actions on the part of other drivers around us are not dangerous to us, period. That's the way it's done. So that's the individual level. The community strategy in terms of getting this word out is varied. The primary thing so far is that I am getting a lot of the information that I'm conceiving and the philosophies, the strategies out to the community on a Facebook page that we've created with Nicole Maher's assistance. And the name of that Facebook page is Stop Coronavirus in Humboldt County Now. This page contains a lot of helpful advice about changing the way that you see this. The virus is not the threat. Our behavior is the threat. Social distancing is a fantastic thing, but on this website, we also talk about creating social pressures. Social pressures are ways that we influence others in our surroundings to do the right things. And if we can influence everybody and we can also always do the right things ourselves, then this whole thing stops very quickly. All the mayhem, all of the fear, all of the various negativity goes away very quickly. At the community level, everything so far has been at the individual level. At the community level, a lot of things that we're doing there also. So the first, in the early days, which was a week and a half ago, we were really concerned that that somebody might introduce this virus into the community. There were no cases at that time. And subsequently, we've developed a number of cases. We knew that the virus would come to the community in the form of a visitor, and that is exactly what did happen. So we have a team, and it's in the early stages of design and implementation at this time. And that team is a team of volunteer health educators. We're eventually hoping to get people from the community to assist in this, in making telephone calls and various other things, various other means of communication with the public. And emergency medical services at Humboldt General Hospital will also be very instrumental through our community paramedicine program and through the efforts of people like Jordan Kohler. So a number of different things that we'll be doing in order to approach primary businesses, people in the hospitality industry, people in the gas station industry, convenience stores, other retail, and we have a number of different partners like Jeff Dawson, who's assisting us at Walmart with a lot of the various procedures and policies that they have that are all well developed at this time. So we're going to make those ubiquitous for all of the various businesses so that when this is eradicated in our community, it can't come back in the form of a visitor from another community. Second thing that we looked at was mine transportation. In the beginning, when Dave and I and Sean Wilkin initially spoke about this, my biggest single fear was that we had a lot of people on buses who were going out to mines. We made contact with each one of the mines, and did not have to take the role of educator with them. In fact, each of us took the role of listener. We were all very impressed with what the mines were doing. They already had wonderful and concerted plans already in place. It was very impressive. And they taught us quite a bit and even brought up things that we hadn't considered. Third thing is kind of controversial, but I think it's very critical, and that is masks. In the early days of this outbreak, N95s became incredibly hard to find, and they still are. Problem is, the concern that most of us have is that if we give everybody an N95 mask, it takes those masks away from people who are at highest risk of exposure. We didn't want to do that because we thought that would be relocating the risk rather than reducing the total risk. There's a group of people here in Humboldt County who are manufacturing at their own homes, at their own expenses, with their own materials, their own time, masks that are built to very high standards of cotton material, have 4 layers and a bellows type design with a tie in the back. And they're becoming extremely ubiquitous in the community. We're coming up with a way to distribute those a little bit better. We've had several people come to my office and deliver them, and I know that Dave Mendiola has also volunteered to assist in distributing those masks. It's a very important thing. You'll hear a lot on the internet about how effective these are, but just because a seatbelt won't protect you in every crash doesn't mean we don't wear them. And the bottom line is a mask is a good part of a safety strategy. Initially, our philosophy was that we would distribute these voluntarily among the bus riders who are going out to the mines. But in light of some of the most recent data that we're finding, it's going to be my recommendation in the next day or two that all people in Winnemucca who are able to get a mask wear a mask when they're out in public. It's not perfect, and there's a lot of negativity about them on the internet, but the bottom line is it gives an extra level of security because we can't always guarantee that all of us are perfect at staying exactly 6 feet or greater away from other human beings. So it's an important strategy. Staying at home, wearing masks, and maintaining social distances. Those are our primary fighting strategies. I'd also like to explain that if a person accidentally gets viral particles on their hands, that can also be transmitted to the face. This virus needs to get into either the eyes, nose, or mouth in order to be able to infect a person. And so if we never touch our face, we're not able to get this virus. Hand washing is very important, and also washing of surfaces. All of that's covered on the website also and in our public education teams. Daycares and families create a new kind of an interesting dilemma, and that is that a couple of 2 people, and because those people are going to be coming together in their own homes, it increases by 2-fold the probability that each of them as a set will become infected. It's like flying a twin-engine airplane. It just increases the probability by 2-fold that you're going to have an engine out. The bottom line is that both members of that couple need to be extraordinarily careful because if one gets this, the other is very likely to. Which brings me to the next issue, and that is daycare centers. That was the next issue on my list. And that is that when the schools closed, creating great hardships for students and educators and other members of the community, we need to realize that if we have many different families who are all pooling resources to have kids go over to one house from 3 or 4 different houses, that's a way to communicate this virus from one family to another. And it's very important that people not do that. If people are sharing resources for childcare at one house for the families of 4 or 5 different people, then essentially what we're really doing is negating the advantages to having closed the schools. Very important to do that. I also want to cover that yesterday, Governor Sisolak had come up with 2 new orders that I think are going to be very helpful in our fight. Businesses, non-essential businesses, and I personally don't think any business is non-essential, but the way that things have been defined, there are certain businesses that are absolutely critical, and I don't mean to imply that people whose businesses have been closed are not essential, that we're all essential. But the new restrictions, even more restrictive, I think are going to help us even more, and I do support Governor Sisolak in his efforts to keep us safe. So the next thing I'd like to move on to is what happens when people become ill. And I'd like to explain that we have a lot of very dedicated people working at Humboldt General Hospital and various other agencies and institutions around town. All of us are doing a wonderful job, in my opinion. I want to explain a little bit about what our community is doing for people who become ill. And at first, I don't think any person is more important than anybody else, but I would like to mention one person by name. Robert Johnson is working over at the West Campus Clinic, which is our primary receiving area for ill patients, people with fevers, coughs, chest pain, shortness of breath, or other symptoms suggestive of COVID-19. Robert is doing a fantastic job, and Robert is quite literally the very tip of the spear in our community in fighting this virus. We ask that people go to the West Campus Clinic if they have symptoms after calling the West Campus Clinic and getting instructions. So the clinic will instruct you on exactly what to do, and usually tests are done while still in people's vehicles so that the exposure is minimized. The hospital has done a fantastic job coming up with a very safe plan that keeps the providers and the ancillary supportive staff safe also. There's also a new ELCO hotline, and we're able to use that as well. There are a number of other organizations that are working on this too, medical students at the University of Nevada, Reno Medical Campus. And they're screening people, giving various forms of brief advice and instructions on what to do based on the symptoms that people explain on the telephone. In short, these people are keeping people out of hospitals where other people may be infected, except when necessary. And next, I'd like to talk about testing. I've been approached by a number of different people. This has been one of the most common questions. The testing is changing very quickly. We're seeing a lot of metabolism in this area. There are a couple of different reasons why. I'd like to point out that ideally we'd be able to test every single person who'd been exposed to this virus or suspected they had been. But as is often the case at the leading edge of various types of events like this, we're in the process of ramping up as this is going on in the initial stages. You're never 100% prepared for something like this. And I think that the testing has been one of the areas that we've really had some issues with. Initially, our hospital was having a difficult time getting enough tests because those tests were not available. It's my belief at this time that the number of tests that we have is adequate as long as we don't use testing as a primary diagnosis strategy. The primary strategy is staying away from all other people, because if everybody does that, then nobody will need to be tested. That's really the strategy. It's a matter of changing our philosophies. It's very important that we do that. So at this time, testing is limited primarily to people who have symptoms, and not just have symptoms, but have symptoms that are highly suggestive of the virus. The concern is that if we test everybody, we'll quickly run out of tests that are needed for critical patients. We're giving preference to people who are involved on the front lines of the fight. And so we really need to know if medical people are infected, because we have the capacity to transmit this to other people. So it's most dangerous. Early cure strategies, meaning that the time that we released people from respiratory isolation, those were generally done by 2 successive tests. But the problem was that we were burning up a lot of tests by doing that. And so now releasing people from respiratory isolation is done based on time, the units of time that have elapsed since the person's last symptoms and also since diagnosis, rather than doing additional testing on people when the tests are in short supply. I do have a little bit more information about tests soon. We'll be in a position to be able to do antibody testing. And those antibodies are going to be a real game changer for us. The problem with testing is that in the early days, the initial nasal swab testing that we're still using was that initially it was taking about 4 to 5 days for those test results to come back. And at this time, some of the tests are coming back quite a bit faster. We're able to receive a test within 24 hours a couple of days ago. Made a big difference in the care of a person who'd come in contact with quite a number of people when we learned that he was negative. So that was kind of a nice thing. But the antibody testing is going to be a real game changer because it's almost instantaneous. We can do it here in the community. Nothing needs to be sent out. And it's available very, very quickly. Also, the number of tests is much less limited than the current tests that we have. So stay tuned for that. I was advised by Karen Cole that the hospital is going to be procuring one of these fairly soon, and I applaud her for her efforts and for the other people who've assisted in getting this device also. Not sure exactly when it's coming. We were told sometime in April. Real game changer, fantastic thing. The next thing is what we do when a test is positive. So this test or this question was asked by a number of different people, and I know that you'd like me to outline this and tell you exactly what this process looks like. When tests are positive in Humboldt County or any of the other 16 counties across our state, those tests go directly to the state epidemiologist's office. And what I can tell you is these people are all over the problem. I've been very impressed by their response. In all cases, when I've called to let them know that there's a new case, they already know of these cases, and they're usually already working these cases. What happens is those people, state epidemiologist's office, comes up with a way using a very advanced computer program and strategies to call people, make contact with various folks. They come up with a list of people who potentially have been exposed to that individual. They question those people on phone and figure out whether or not that constitutes a true contact. And if it does, then the state epidemiologist's office will put those people into quarantine, usually for 14 days. That's actually a longer quarantine period than the people who are known to have the virus in some cases. And the reason is because the longest of cases are taking about 14 days from the time of contact with the person who's infected until we can be sure that they're not infected themselves. The problem comes in where tertiary, what are called tertiary contacts, meaning that a person has contact with a person that has contact with somebody who's known to be positive, that second person in a tier, are they at risk? And that's a very difficult question to answer, and we're always behind the power curve on that question. That's one of the reasons that I would shift your attention back to something that I consider to be more important. If every single person maintains the correct distance away from other people, all other people at all times, then if the state epidemiologist's office ever has to call you, if you explain that I have never been closer than 6 feet from another human being since this started, the state epidemiologist's office will congratulate you and will let you go. That's why we need to focus on social distancing and not any of the other strategies that we've talked about. Social distancing makes everything else unnecessary. The other things are done for extra security. Hospital preparedness. I have attended a number of meetings that the hospital is having every single morning at 8 o'clock in which we discuss the readiness, the strategies, the supplies, the staffing, and various other aspects of this emergency. It's my impression, after having attended many of these meetings, that the hospital is well prepared to deal with the complications in the event that the community loses control of this virus. The hospital is there for us. I'm very impressed by the work that they're doing, and I'm convinced that they're well prepared for this. But I would invite members of the community to do all the right things to make everything that the hospital is doing unnecessary. Very dedicated people there who are more than happy to help people if they become ill. I am hoping very much that they don't have to do anything. I'd love that, if everybody is well. I'd like to discuss one other thing, and that is an ancillary hospital that will be going in on Friday. It's a medical facility that will give us in our community the ability to care for other people in the event that this outbreak were to get out of hand. But I would implore you, we are absolutely in control. It is critical that all of us make the efforts that are being taken to control this virus in the event that it gets out of hand unnecessary. We have the power to do that. I'm going to talk a little bit about my role in this, and I can tell you that I'm very honored to have been tapped by you folks to help in this crisis. And I'm very, very proud of what we're going to be able to do here. I'm only one person, and I think we have some wonderful resources in our community, some very dedicated people, and I would defer to them as the people who are really doing wonderful things here. All of the members of the medical community and all of the members of our general community who are the very ones who are going to stop this. I am a person who thinks of strategies. I'm a person who announces those strategies. I educate people, and I also try to energize people to do the right things. And that's my role in this. I want to offer a couple of closing thoughts. Rather than to summarize what I've talked about, I want to offer you an invitation. I want to invite the people of Humboldt County to do something truly grand, something that we can be very proud of. I want to invite you to do all the right things all the time, and to invite others and engage others to do the right things too. To be kind to others when you see people doing things that are dangerous. Everybody's stressed right now. And when you see people who are doing things that they don't realize are dangerous, please reach out to those people so that everybody can get through this. Nobody in our community needs to die. I want to extend one last invitation, and then I'm going to close. We're not the only ones who are having a hard time. People from all around the world have had their entire lives disrupted by this horrible illness. The people of Humboldt County are in a very unique position because Humboldt County is remote, Humboldt County is well defined, and Humboldt County in general has very motivated people who are able to do something for science that would be very important. If we can eradicate this virus in our county, the data that we can create will be immensely helpful to people in other communities who are suffering as much as we are. If we can do all the right things, the data that we can create will be helpful to epidemiologists for a very long time, and it'll also be helpful to people everywhere. I invite you to do the right things. Thank you.
Thank you, Dr. Stringham.